The VA recognizes that brain injury is one of the most common injuries veterans can experience. Brain injuries can occur in two ways. One, by experiencing a violent blow to the head, or TBI, or two, through a rupture or blockage of blood vessels in the brain, commonly called stroke. In either case, moderate to severe brain injuries can have lasting effects on the veteran's life, as well as the lives of those who care about them and support them. Today, we would like to spend some time with you, the caregiver of a veteran with a moderate to severe brain injury. We will be teaching you about the possible effects of your veteran's brain injury, how the professionals here at the VA's Brain Injury Clinic assess and treat these effects, and the important role you as the caregiver play in your veteran's brain injury treatment. The most important thing we want you at the Rocky Mountain Regional VA to know is that we value you as a vitally important support for your veteran. As such, we are just as dedicated to helping you in this journey as your veteran. So, at the end of this video, we will discuss the many services the VA offers to aid in your role as a veteran caregiver. So, your veteran suffers a brain injury. What happens next?
So initially, there's just a lot of healing and resting that needs to happen after that level of brain injury. So as a physical therapist coming in to a situation with a brand new injury, I'm gonna first sort of educate the family on this initial healing stage, especially a severe brain injury. They often need a lot of rest, low stimulation, like darker room, no TV on, one person at a time talking, even a moderate. It could even be something like with a concussion or on the whole end of the spectrum, the brain needs an initial resting period. Kind of once they start gaining more function, alertness, they're sort of moving through the recovery phase of that initial brain injury, then kind of starting to learn about what their symptoms and what their deficits are. And then somebody probably would transition to rehab, where rehab is high intensity exercise focusing on function. So we're starting with learning what can they do, what side of the body might be more affected, are they weak, or is it more understanding the control factor. We start educating the family on learning about what the patient can start doing for themselves and helping less and watching more, kind of starting this teeter, right? Or initially we're doing a lot of things, and then as the patient gets better, we're asking them to do more and family to do less.
If your veteran has been diagnosed with a moderate to severe brain injury, your primary doctor will refer them to the Brain Injury Clinic. The team at the Brain Injury Clinic will then see your veteran for an initial assessment of the ways the brain injury has impacted the physical, mental, and emotional functions of your veteran that could impact their daily lives. This team is made up of a physiatrist, neuropsychologist, occupational, physical, and speech therapists, as well as a social worker. As our brain injury clinicians have shared, we at the Rocky Mountain Regional VA value you, the caregiver, as a vitally important player in your veteran's recovery and adjustment to a new normal. We also acknowledge that your life, your physical and psychological functioning are also dramatically impacted by your veteran's brain injury. Because of your importance to the VA, we have several programs designed to address the needs of our caregivers. Let's hear from the team, as well as a caregiver specialist, to learn more about just a few of these programs.
My name is Susan Ladley, MD. I am a physiatrist, which is a word for a doctor that treats people with disabling injuries and illnesses. I see veterans every day who are struggling with recent or remote injuries that have impacted their ability to function. I sometimes see them alone in a clinic room. Sometimes I see them in conjunction with a whole team. Other times I use video conferencing and talk to the veteran in their home. I meet with them and do a careful evaluation to see how the injury is affecting them. And I will validate the veteran's experience and tell them how it is that I understand how the injury has, connected to their current experience and the current difficulties. And then from there, offer available treatment. I may offer to do a deeper assessment, particularly in the cognitive realm, to help understand a little bit more what the strengths and the challenges are. So it's really getting a handle on where we are now and then charting a pathway toward a realistic improvement in quality of life. Well, often the event that caused the brain injury causes other injuries, such as fractures in the arms or legs, injuries to the spine or spinal cord, and also psychological trauma and scrapes and lacerations, loss of limb. So really, I see brain injury in conjunction with lots of other very significant injuries, and then sometimes the brain injury is the only problem. Well, people experience a loss of independence, right? So a loss of independence with their mobility, being able to take care of themselves, to manage their affairs or go to work. There's often pain. So those are the other injuries that often will heal, but they'll take a long time to heal. Well, caregivers can be advocates, so they may recognize something that isn't being properly attended to. They may provide some of the physical assistance that is required as people recover from their injuries. They often act as psychological support people, right? So they are there trying to reassure the veteran that there is a better future ahead and remind them of the pieces of their life that are still in place and working well. This can be a lot to handle, particularly if there's an emotional connection, like a family member who's doing the caretaking. I would say take care of yourself, which is often a tall order. So adequate rest, good nutrition, regular exercise is absolutely paramount, because this is a long-term situation usually. Seeing your own doctor, tending to your own health in a formal way, and getting support. So perhaps a support group, perhaps simply from your friends or family. I think one needs to be intentional about creating space for that. Now, if the caregiving, just in terms of time, is so overwhelming that it doesn't allow for this, then the caregiver should reach out to the VA to discuss if there is more support that can be offered by the VA. Because certainly some individuals require more assistance than one individual can really provide in a healthy way. We should acknowledge that the treatments aren't yet what we hope they would be, okay? We're hoping to make more progress in getting people feeling better. I also think that there isn't enough support for caregivers, so getting yourself and your loved one the help they need does require some advocacy. Seek out the people who are listening to you, and I think that you will find that there are many people at the VA who will take an interest and try to help.
Yeah, I'm Dr. Jason Kazmarski. I am the neuropsychologist on our brain rehabilitation team here at Rocky Mountain Regional VA. As a neuropsychologist, I'm really focused on three primary areas. And so the first is emotional changes that people experience, which are really, really common after these types of injuries, particularly things like depression, which can have just a tremendous impact on how folks are doing. In addition, after moderate or severe TBI, it's really common for people to experience behavioral changes. And those behavioral changes can be particularly challenging to manage at home or in other kinds of social environments. What can be one of the biggest challenges of being a caregiver is for many folks who have experienced a moderate or severe TBI, there are significant behavioral changes. And this can include things like impulsivity, so people acting before they think, as well as disinhibition, or people who really have a hard time stopping themselves from acting in ways that sort of immediately come to mind, or from stopping themselves from saying things that come to mind. We all sort of go through life inhibiting things we say, inhibiting ways that we behave. And this is usually something that we do without a lot of thinking. When people are not able to do that anymore, when they act impulsively, when they act in these disinhibited ways, it can be challenging sometimes for caregivers to really recognize that that's not intentional behavior, that people aren't acting that way to annoy, to upset, or to be difficult. It's behavior that's being driven by changes to the brain, by an actual physical or neurologic inability to sort of tamp down that behavior or to manage that behavior more effectively. So I think that's the thing that in my own work with caregivers, try to focus on a lot, is understanding that this isn't on purpose. This isn't someone trying to be difficult. This is a result of the injury. And I think when caregivers are really able to take that information in and really understand that, it can make some of the challenges a little bit easier. Not easy, but a little bit easier. And it can also really help uh, prevent that burnout that caregivers so often experience. Finally, many people who experience moderate to severe TBI also experience significant changes to their thinking skills, to their cognition, and addressing, understanding, and managing those can also create quite a challenge. The role of neuropsychologists in actual treatment can vary a great deal. Some neuropsychology programs are very hands-on and can involve really getting in with the veteran, with other therapists in the moment while treatment is occurring, and problem solving any difficulties that come up or any potential barriers to people's ability to really benefit from the treatment that they're receiving. Other times, neuropsychologists might be involved in cognitive rehabilitation, which can include the development of different skills and strategies to work around any cognitive difficulties that are identified on testing, as well as things like practice of certain cognitive skills, certain thinking skills that we know can improve with some of that practice. Um, in our neuropsychology clinic, we tend to act more as consultants, where we're developing recommendations that we're then sharing with our other providers and with the veteran and their family, including caregivers, that we think will be helpful. So we do less direct intervention from a neuropsychology perspective in our clinic than may occur in other locations around the country. All neuropsychologists are also psychologists, of course, and so another role that neuropsychologists sometimes play is one of rehabilitation therapist, of working directly with veterans and their caregivers to adjust to any cognitive, emotional, or behavioral changes that people may have experienced as a result of their injury. So that can look kind of like standard mental health therapy, sort of sitting down and talking, developing skills, developing strategies, and working through those difficulties in a really collaborative, really team-based way.
I usually describe the therapies as the Holy Trinity: speech therapy, occupational therapy, and physical therapy. And if you put physical therapy on one end, being that they're really going to be focusing on physical things, walking, balance, endurance, strength. And then on the other end, you have speech therapy, which is focusing a lot on cognitive skills, right? Memory, thinking, processing. And then somewhere in the middle is occupational therapy, which is a combination of how physical skills and cognitive skills come together.
To do by yourself, because I think caregivers are special people. Like, to do that is hard for a lot of reasons. Even if you love the person, even if you're paid for it, whatever it might be, it's a full-time job. And so oftentimes there's resources that help you be the best caregiver you can be, and sometimes that's not being a caregiver. Having time off from being a caregiver can make you a better caregiver, right? And so finding that balance of, what things are you able to provide and what sort of stuff do you need support from, whether that's, I'm not a social worker, so I don't have all the resources, but I think what I continue to be impressed with is that there are a lot of options out there for support. It's just, I think sometimes the hardest part is figuring out which ones are the ones that you need. And then just to be patient with yourself. I think, like I said, even providers sometimes are like, I'm not sure what's going on here, or what's breaking down, or what it is, and that's our background. And so being patient with yourself and trying to figure out and adjust, like, that's super appropriate for caregivers to do and need to do.
Get as many people in your village as you can. Get family involved, get friends over, start to figure out how they can help you. Also taking care of yourself, learning about what your limits are and when you've reached them, and how to sort of take your own breaks. Because I think another thing too is I educate a lot of people. If something were to happen to you, what would happen to them? So a lot of times, I have a lady right now who just called me because her husband's in the hospital and he really wants to come home, but he's not safe. And we kind of started talking about it. And I said, well, what happens if you're moving him and you fall and you break your arm or you hit your head? There's not going to be any option for him to come home then. It's going to kind of be out of everyone's control. So I think, knowing your limits, getting as many people available to you as you can, tapping into church resources, community resources, more people the better. Especially from a social perspective. I feel like isolation, especially right now, is terrible. People aren't getting that same social communication and interactions, and so I think having, even if it's a virtual team or somebody just calls and does a FaceTime once a week with somebody while they're home, just kind of gives people a nice social interaction with somebody else and a break.
But the Caregiver Support Program itself, by name, offers two things to family caregivers. One of the things is the monthly stipend that is paid to an identified family member who takes care of the veteran. The other program that is offered by the Caregiver Support Program, or the other service, if you will, is just that, caregiver support. So these can be people who would not be eligible for the stipend, but are enrolled in the Caregiver Support Program for education, information, support groups, resources, all around supporting the caregiver.
So I'm Jonathan Gill. I'm a licensed independent social worker at the VA. I've worked at the Eastern Colorado VA for a little over a year, and I work with the traumatic brain injury team. A lot of times when someone has experienced a brain injury, they'll meet with a lot of different medical professionals, and for my role as a social worker, I'm there almost to be there sitting next to you. I'm there to really understand kind of all the questions you have, all the questions that the team has for you, and try to help be that translator, that interpreter between the two of you, because it's a lot of information and it's just a really overwhelming time. So I think really I see my role as a social worker as really going on that journey with you to make sure that our team understands your needs and that you understand kind of the recommendations and all of the plan that we can put in place that fits with that goal. And the social worker is really going to be there to listen and ask questions to understand what is the biggest challenge that you notice of your loved one and your loved one notices in their daily life. So I like to I use a lot of analogies when I talk about what a social worker does, and one of my favorites is air traffic controller. The VA is a huge runway. There's a lot of different destinations you can need to go. There's a lot of different services that you need to be flown in. And while there's a lot of resources, if someone isn't managing that, it can be really dangerous or overwhelming. And so a social worker really is there listening for your needs, the needs of the team that need to be addressed with you and your loved one to understand what's going on, and just really navigating all of those various things that could occur. As a social worker, I'll be meeting with you and your loved one to understand what happened, first of all, from your own understanding, from your own story. What happened to your loved one? What is going on? And how have you been coping with that since? As a social worker, I really want to listen for understanding how you're addressing this new challenge that your loved one's experiencing, how your loved one's handling that. Really, as a social worker, I want to understand what's happened, where you're going, and really just being on the periphery at the very minimum, be on the sidelines with you to know where you're at in your goals and your loved one.
Thank you for taking the time to learn more about brain injury, the VA's Brain Injury Clinic, and some of the caregiver support programs here at the VA. To learn more, please contact your Patient Aligned Care Team, or PACT, social worker. If you are unsure of the name of your PACT social worker, please call the VA main number and ask to speak to your social worker. Have your veteran's name and social security number available to facilitate this connection. Remember, the VA values you as a primary player in your veteran's care, and we are here to support you in this role. It is our desire that together we can help your veteran live a rich and meaningful life after brain injury. As a caregiver, we thank you for your service.